Get started with pharmacology for 400. All right. Remember to say what is if you want the points. If you don't want the points, don't say what is, just answer. Okay. All right. And let's go. All right. You also do not have to wait for me to answer in order to, or read the question in order for you to answer. All right. This is Farm 400. It says, an outbreak of head lice infestation has occurred at a local school. The school nurse is providing instructions to the mothers of the children attending the school regarding the application of malathion. The nurse should tell the mothers to take which action? 1. Apply the lotion immediately after washing the hair. 2. Pour the lotion onto the hair and then rinse immediately. 3. Allow the lotion to remain on the hair for 10 minutes and then rinse with water. Or 4. Leave the lotion on for 8 to 12 hours and then wash the hair with non-medicated shampoo. What is our answer? Please don't forget to say what is if you want the points. All right, we have Instagram and TikTok live going. So we're going to have one winner from each platform. All right, first person to say the correct answer on each is going to, on my screen, is going to be the winner of those points. So let's see who answers correctly first. All right, guys, here's a little test taking strategy. Whenever you have any type of question, NCLEX or not, I always recommend reading the full thing one time, like fully through, question and answer choices. And then when you finish reading all of that at least once, go back and read at least the last line so you can remind yourself of what the question's actually asking. Okay? In this case, we have a lot of people saying 3. So let's see if that is our answer. It's actually what is 4. The answer is what is 4. It says the instructions for the use of malathion are as follows. Sprinkle lotion on dry hair and rub gently until the scalp is moistened. Allow to dry naturally. After 8 to 12 hours, wash the hair with a non-medicated shampoo. Rinse and use a fine-tooth comb to remove lice. And repeat in 7 to 9 days if needed. All right, so the answer is what is 4. Hello, everybody. Hey, Harrison. All right, so let's see who's the first person on both Instagram and TikTok to correctly say the answer, which is what is 4. First person to say what is 4, or, what is D, whatever. Is that Priscilla? Prissa? No, sorry. Prissa21 is the first person to say what is 4, what is D. Great job, Prissa on TikTok. All right. So once again, underscore Prissa. Great job. You are the winner of 400 points. So you now have 400 points on the scoreboard. All right. First person to say what is 4 on Instagram. I think it's Lexi. Sure is. It's Lexi. Great job. It's Lexi. You now have 400 points on the Instagram side. All right, guys. If you got this one wrong, it's okay. That is why we do our practice questions. Just make sure you note the rationale so that just in case you see this question again or this topic again, you'll know the correct answer. All right. All right. So it's Lexi, 400 points. All right. Great job. Now let's go into our next topic. All right. And since we are Priska, thank you for correcting me, Priska. All right, since we are in mental health and pediatrics, we're going to do one of those. Let's do mental health. What do you guys think? Let's do mental health. Well, actually, Prisco just won, so she's going to choose it. She said funds for 100, so let's do funds for 100. All right, guys. Oh, this is a good one because I just had a post about this. All right, this is fundies for 100 points. Remember to say what is if you want the points. You don't have to say what is if you don't. Okay? The person with the highest amount of points at the end of the game on both Instagram and TikTok will win a free Ultimate Nursing School bundle. All right, so the nurse is caring for a client with meningitis and implements which transmission-based precaution for this client? 1, private room or cohort client. 2, personal respiratory protection device. 3, private room with negative airflow pressure. Or 4, mask worn by staff when the client needs to leave the room. What is our answer? Remember to say what is if you want the points. All right. We have a patient or a client, says client. We have a client with a diagnosis of meningitis. So which transmission-based precaution is going to be appropriate for a client with meningitis? Ooh, so tell me what answer you get. And remember to say what is if you want the points, but you also need to tell me why. All right. What kind of transmission-based precaution is meningitis? Would meningitis be? All right. These are the actual actions and implementations that you can do. But what is the actual transmission route of meningitis? Okay, so tell me what you got, tell me what answer, and then tell me why. And by why, you're telling me because it is blank precautions. All right, what is it? Airborne? Is it droplet? Is it contact? What kind of transmission route is meningitis? All right. So let me see what you guys are saying on both TikTok and Instagram. I'm seeing what is 1. Oh, I'm actually seeing a healthy mix, honestly. I'm seeing 1s, 3s, and 4s, and people are saying airborne and droplet. So I'm not sure which one it is as far as what you guys are saying. Lexi said, what is 2? Airborne and droplet. Meningitis is standard. Droplet precautions. All right, let's go ahead and see what our answer is. Y'all ready? Drum roll, please. And the correct answer to this is, what is 1? Meningitis is transmitted by droplet infection. Great job, guys. Meningitis is transmitted by droplet infection. I'm going to tell you how I knew that. I'm going to tell you how I knew that after we finish this, okay? So, all right. So, yes, the answer is what is 1? So because meningitis is transmitted by droplet infection, precautions for this disease include a private room, or they can also cohort that client with another client that has the same or is infected by the same microorganism. So if another client has meningitis, they would be allowed to cohort in the same room, either that or a private room. Okay. And also the use of standard precaution masks is also a precaution for this disease. All right. Now, private negative airflow pressure rooms and personal respiratory protection devices are required for clients with airborne diseases, such as tuberculosis. Okay. Remember our transmission-based precautions. Okay. You have, like I said, airborne, you have droplet, and you also have contact. Okay. If you guys don't follow me on Instagram, or if you did not participate in Camp Nursing School, you probably missed that post. But a good way to help remember which diseases and disorders belong to which transmission, a good way to remember droplet is like Spider-Man. Spider-Man's gonna drop on by. Okay. Now Spider-Man's gonna mean a slew of things. The SPIDERMAN, all that's going to mean something different, but the M does stand for meningitis. Okay. Now for the airborne diseases, you want to think about MTV. Okay. MTV is on air. All right. MTV, that T in MTV stands for tuberculosis. So that's why that's there. And then the last one says, when appropriate, a mask must be worn by the client and not the staff when the client leaves the room. All right, so that's what number 4 gets you. All right, mask would otherwise be worn by the client every time they needed to leave the room, but this says mask worn by staff. So this was a great case of make sure you are not reading too fast. All right, so let's see who got this one first. What is it? 1 is 1. First person to get what is 1 on TikTok is Mama Meeks. Great job, Mama Meeks. you are on the scoreboard on TikTok for 100 points. And then on Instagram, we have, who's the first person to say this? What is one? First person to get this one is Yes Ka. All right. Yes Ka. All right, let's go ahead and go on to our next question. All right. You're welcome. All right, let's do pediatrics. Let's do peds and let's do it for 300 points. All right, guys, peds for 300 points. It says the nurse is collecting data on a child with a 1-week-old cat scratch injury. While assessing the scratch, the nurse notes redness, heat, swelling, and red streaking surrounding the area. The child states that the scratch hurts. Cellulitis is diagnosed. When providing home care instructions, which statement by the mother indicates a need for further teaching? 1. The child should rest in bed. 2. I will apply cool, moist soaks every 4 hours. 3. I should take the child's temperature and watch for a fever. Or 4. The affected extremity should be elevated and immobilized. Which statement by the mother indicates a need for further teaching? What is our answer, guys? Remember to say what is if you want the points. Make sure you say what is if you want the points. And then get in the habit of saying, or at least letting me know or letting yourself know what the rationale is. What is the reason behind why you chose what you chose? Okay, that's how you develop your critical thinking. I'm getting like 1s and 2s. All right, please remember that this says, which statement by the mother indicates a need for further teaching? All right, if you're looking for a statement that indicates a need for further teaching, you're looking for the incorrect statement. All right, so let's see what our answer is. The answer is what is 2. What is 2 is the answer. I will apply cool, moist soaks every 4 hours. All right, that is a statement that lets you know the mother needs further teaching. That's an incorrect statement. All right. Let me see who got what is 2. Before we read it, let's see who got what is 2 first. All right. So on Instagram, Yes Ka got it first. And then on TikTok, who got it on TikTok? Let's see. First person to say what is 2. First person is Priska again. Great job, Priska. All right, Priska, you have 400 points. So you just got another 300. So you now have 700. All right. And yes, Kyle, you already had 100 points. You got another 300. So you now have 400 points. And you're tied with It's Lexi. All right. So guys, let's go ahead and go over the rationale. So it says cellulitis is an infection of the dermis and the underlying hypodermis of the skin. Remember our layers of the skin. The child with cellulitis should rest in bed, and the affected extremity should be elevated and immobilized. Okay, so 1 and 4 are things that are actual instructions, home care instructions. All right, if the mother would have said 1 or 4, she would have got a clear understanding of what the instructions were. So because those are correct, 1 and 4 should be crossed off your list. Okay. Then it says warm, moist soaks applied every 4 hours increase circulation to the infected area, relieve pain, and promote healing. All right. Frequent hand washing is essential to prevent the spread of infection. The child should be monitored for signs of sepsis, increased fever, chills, and confusion, or the spread of infection. All right, so the answer, once again, is what is 2. It's not cool and moist soaks every 4 hours. It's warm, moist soaks every 4 hours. Okay? Y'all got that? Understand that? Thumbs up if you are ready to go, if you understand that and ready to move on to the next question. Perfect. People on Instagram got it. I mean, people on TikTok got it. What about you guys on Instagram? Y'all ready to move on? All right, perfect. Let's go. Somebody on Instagram said false. Who's false? All right, now let's. Which one do? Let's do. You're false. Let's do mental health for 500. Let's do it. A client with the potential for violence is exhibiting aggressive gestures, making belligerent comments to the other clients, and is continuously pacing in the hallway. Which comment by the nurse would be therapeutic at this time? Ooh, I know y'all hate that word therapeutic. 1, what is causing you to behave so agitated? 2, why are you intent on upsetting the other clients? 3, please stop so I don't have to put you in seclusion. Or 4, you're going to be restrained if you do not change your behavior. Kick rocks. Don't pay attention to whoever another girl 002 is, because it's clearly spam. It's clearly spam. Don't pay that person no attention. Go ahead and answer y'all questions and get y'all NCLEX review in, child. What is our answer? We got mental health. Y'all know what mental health, the word therapeutic communication is used every 2 seconds. So what comment would be the most therapeutic? Oh, well, no, it doesn't say most. Which comment by the nurse would be therapeutic at this time? All right, we have a client that's exhibiting aggressive gestures, a potential for violence. What is that? And they're making belligerent comments to the other clients and continuously pacing the hallways. All right. What is our comment that would be therapeutic? Okay. Let's look and see what y'all saying. Y'all ready? What is 1? The answer is what is 1. The appropriate response is to ask the client what is causing the anger. All right. What is causing you to behave so agitated? Make the client aware of the behavior and may assist the nurse in planning appropriate interventions. Asking why is confrontational. All right. And could further escalate the client's behavior. The remaining options constitute threats to the client, which are inappropriate. All right. You get it? All right. So you never want to asking why is confrontational. Okay. So please behave that. Please remember that. So let's see who got it first. So you never ask why or question, and restraints are the last option. Ooh, I love that. First person to say what is 1 is Ashley Maney on TikTok. Great job, Ashley. You now have 500 points. So Ashley Maney, 500 points. And then on TikTok, where we at? What we got? First person to say what is 1 on TikTok is Momo Salil. Hey, Momo. What's up, boo? I recognize you. Welcome back. All right, Momo, you have 500 points. All right, next one. Let's do some farm. I see you guys saying that you're scared of farm. You hate farm. Well, let's do one more. Let's do adult health first. No, let's do farm first and then I'll go back. Let's do farm for 300. Farm for 300. All right, so this one says a client has an as-needed prescription for loperamide hydrochloride. For which condition should the nurse administer this medication? Ooh, this is a good one. This is a good one because this is a commonly prescribed medication. This is one that this is a real life, a realistic medication. Okay, so knowing the indication for this medication is definitely going to be of use. No matter what type of nurse you're about to be, most likely you're gonna know about this one. Okay, so see what your answer is. I'm about to block you, another girl, right? I'm about to block you right now because you're annoying me and you're distracting from people trying to learn, and I don't have time for it. Okay, blocked. Sandra blocked. Okay. All right, guys. I'm so sorry about that. I just blocked her. I promise you, I just blocked her. I do not have time for ridiculousness. So what is our answer, guys? Loperamide. Loperamide. Y'all ready? It's what is 3. Ooh, that diarrhea. All right, loperamide is an anti-diarrheal. Does anybody know the generic name for, okay, the generic name of this drug is loperamide hydrochloride. Does anybody know the brand name? Please note, for the actual NCLEX, you do not need to know the brand name. All right, knowing the brand name, it will be good for you once you actually pass the NCLEX and get into the real world. Because actually in the real world, you use more so the brand name than the generic. But for the actual NCLEX test and for your nursing exams, you'll be using the generic. So that's why it's so important to know both. One's for school and just to make it through, and one's for your actual everyday nurse life. All right, Imodium. That is Imodium. Okay. Loperamide, or brand name Imodium, is an anti-diarrheal agent. It's used to manage acute and chronic diarrhea in conditions such as inflammatory bowel disease. Loperamide also can be used to reduce the volume of drainage from an ileostomy. All right, it's not used for any of the other conditions in 1, 2, and 4. All right. I said any medication tips. I'm sorry, that's the main thing we're having trouble with. As far as tips for learning medications and pharmacology, the best tip that my top 2 tips is to practice. The more you practice, the more medications you'll come across. All right, it's the best way to learn. And then 2, when you're learning the medications and doing your drug cards and everything like that, focus on the classifications and study by the classifications versus just the individual medications. Okay? All right, so did I say who got that one? I did not. Let's see who got this one. What is 3? For everyone else that probably already took farm, those of you that have already passed nursing school, please give your best advice when it comes to studying farm, passing farm, tips on passing the NCLEX for the farm portion, anything you can, while I go ahead and see who got the points first. Offer your insight, please. Thank you very much. All right, so the first person to say what is 3 on TikTok is M Tangle 806. Great job. M Tangle. Oh, I'm sorry. EMT Angel 806. Wow. Good job, Sam. You now have 300 points. And then on Instagram, first person to say what is 3 is Momo Solil again. Hey, Momo. Great job. All right, so Momo, you already had 500. You just got another 300, so you now have 800. All right. Now let's go over to adult health, and we'll do it for 400 points. Okay, let me see what y'all are saying. You understand why I'm such a fan of you. Oh, thank you, high value nurse. Stop it. Thank you. Future ER nurse said, I'm in farm now, and they said that the next gen NCLEX will be mostly farm and management of care. I don't doubt that at all. I do not doubt that at all. All right, let me see what y'all are saying on TikTok. All right, thumbs up if y'all ready for the next one. All right, thumbs up if you're ready for the next one. Perfect. All right, let's do it. You guys ready on Instagram? All right, let's go. This is adult health, aka MedSurg, for 400. The ambulatory care nurse is providing instructions to a client who's scheduled for a small bowel biopsy. What should the nurse tell the client? 1. Clear liquids only are allowed on the day of the test. 2. A signed informed consent form will need to be obtained. 3. A tube will be inserted through the rectum to obtain the tissue sample. And 4. A full liquid diet will need to be maintained for 48 hours after the procedure. Remember to say what is if you want the points. If you don't, you're just here for the review. Go right ahead. All right. We have a client scheduled for a small bowel biopsy. All right. And it says here we have ambulatory care nurse. Okay. What should the nurse tell the client? What is our answer? Remember to say what is, and then after you answer and say what is, whatever, tell me the rationale. Tell me why you chose the answer that you chose. Give me your rationale. All right. And while you're giving me your rationale, whenever you're taking practice tests, whether it's NCLEX Jeopardy or, another resource, always ask yourself why the rationale or what the rationale is, why the answer is, or why you selected the answer you selected. Not only will it help with critical thinking, but it's going to actually put it into perspective for you so you can actually have a reason and an evidence-based rationale as to why you chose that. Now, sometimes you won't know what the answer is and you'll just guess, but for that, you have to be realistic with yourself and just know that you have to review that later on. So let's see what this one is. Y'all ready? What is 2? That informed consent. Oh, I think I saw that on everybody's thing. So great job. Oh, I'm so glad I am so glad we all got that correct. All right, so the answer is what is 2? A signed informed consent will need to be obtained. Okay. Let me see who's the first one to say what is 2. First person to say what is 2 on TikTok is Eusenia22. All right, Eusenia22. Great job. You now have 400 points. And then on Instagram, first person to get it is Yes, Ka. All right, Yes, Ka, you already have 400 points. This one's another 400, so now you have 800. All right, let's go ahead and read through the rationale. If you did not choose what is 2, this is a great time for you to note the rationale so that next time if you see something related to either informed consents or procedures, period, this is giving you the rationale and the reasoning behind why the answer is what it is. All right, it says a signed informed consent form is required for this procedure. The client is instructed to maintain a clear liquid diet for 24 to 48 hours before the biopsy and to withhold all food and fluids after evening meal before the day of the scheduled biopsy. A small bowel biopsy involves removal of a tissue specimen from the small intestine for examination and aids in the diagnosis of diseases of the small intestine. A small biopsy tube is passed through the client's mouth and is monitored let's say fluoroscopically. Yep. Fluoroscopically until it reaches the desired location in the jejunum. A normal diet may be resumed after the procedure as soon as the gag reflex returns. Ooh, that's important. That is, see this, okay, real quick. Even though this wasn't the main idea of this question, this last line is very important, and I usually see this on NCLEX exams when they're talking about like surgeries, period. This is something that they definitely want you to know because of safety. Anything that has to do with safety, because the theme of the NCLEX is safety, is client safety, that's what you're going to expect to get the most questions about, or questions about just period. All right. So whenever you have any type of surgery or procedure, especially surgery that's involving like anesthesia, that whenever they're asking, oh, when can I eat again? When can I ingest something again? That normal diet can be resumed after procedures as soon as the gag reflex returns. Okay? Emily on TikTok just made another very important point. Gag reflex, and then assess for bowel sounds. Okay? Assess for bowel sounds. Make sure those bowels are woken up as well. All right, now let's do fundies again, but let's do it for 500, okay? All right, y'all cool? Y'all ready to do fundies for 500? Give me a thumbs up if y'all are ready. Thumbs up if you guys are ready. What's that? Is that with speech therapy too? What do you mean is that with speech therapy too? All right, thumbs up. Y'all are ready. All right, let's do it. All right, a registered nurse, RN, asks a licensed practical nurse, LPN, to set up a hospital room for a client who is being admitted with a diagnosis of tonic-clonic seizures and asks the LPN to institute seizure precautions. The RN checks the client's room before the arrival of the client and determines that which item placed in the room by the LPN is unsafe. 1. Restraints. 2. Nasal cannula. 3. Suction catheter. 4. Padding for rails. What is our answer? What is our, and remember to say what is if you want the points, but go through the actual situation. All right. We're setting up a hospital room for a client who's being admitted with diagnosis of tonic-clonic seizures. Okay. This is, I'm going to say what I'm going to say afterwards, after y'all answer. Okay. Answer the question and then tell me why. Answer the question and then tell me why. Which item placed in the room by the LPN is unsafe for this client with a diagnosis of tonic-clonic seizures? Ooh-wee. I'm looking at what y'all are saying. Y'all are saying 1, which is restraints, because restraining a patient during a seizure is wild. Let's look and see. Look at that. What is 1 is the correct answer. All right. Restraints. Okay, first of all, if y'all are in, this is a side note. If you're in fundamentals, or honestly, it doesn't have to just be fundamentals. If you see the word restraints, I want you to make sure you look around that either question, that answer choice, and really pay attention to it, because if it's asking for what the wrong thing to do is, and it has restraints, it's a good amount of chances. It's a good chance that the restraints is the right answer of why it's the wrong answer. Does that make sense? All right, restraints are restraints can really cause client injury, and like I said, restraints. The NCLEX is all about client safety, so they're going to throw that word restraints at you in almost any situation to make sure and be able to assess that you know that restraints can cause injury and they are not like the first line of defense. Just because a patient's being annoying or whatever reasoning that you have, restraints is not going to be the answer 8 times out of 10. Okay? Especially without an order. All right, so it says seizure precautions include keeping side rails up and padded if the client has tonic-clonic seizures. Remember, there's different types of seizures. Tonic-clonic is a type of seizure. All right, and usually with tonic-clonic, they have violent like shakes. So their environment and making sure that their environment is safe is very important. All right, ensuring that suction and oxygen equipment is available, absolutely, especially when you have seizures. And then disabling the locks on the bathroom and room doors. Restraints are not used and can result in client injury again. I'm saying, my seizure patient here, my friend got restrained. Yeah, why did your friend get restrained? And if restraints are a thing, there's so many rules that go behind implementing restraints. It's not even okay. it's not even okay. It's more of a hassle to get the right order and to like safely apply restraints than they're trying to pin her as a drug addict. Ooh, wow. All right, guys, let's see who got what is one first. Okay. First person in TikTok to get it is Ashley Maney. Great job, Ashley. So that's an extra 500 points. Ashley, you already had 500, so you just got another 500. You now have 1,000. Over here on TikTok, on Insta, first person to say what is one is Momo Solil. All right. Great job. So yes, everyone pretty much got that restraints are the most invasive and usually cause more injury than they're trying to prevent. So great job, guys. Let's do mental health again. All right, Momo, you got another 500. You now have 1,300 points. Okay. Let's do mental health, y'all. Y'all ready? Thumbs up if you're ready for mental health. I take NCLEX tomorrow, and doing this Jeopardy has been helpful. Yay! First of all, good luck to you. Boop, there y'all go. Good luck to you, love. I know you are going to come back in about 2 days and let us know that you passed, and you are now Kick Rocks, either RN or LPN. Yes, nurse. So good luck to you, and I can't wait to hear how you did. Nurse gang. All right, guys. Next question, mental health for 300. The nurse is monitoring I'm seeing 3s, but y'all need to tell me why. Y'all needs to tell me why. Shanice said 1, 2, and 4 are saying the same thing. Don't make me laugh. Do not make me laugh. Ashley came back saying, what is 3? I know, Priska said it's 11. My phone died. I'm sorry. It's back on now. I promise. Go back. It's on. All right, y'all ready for this one? Y'all ready? Whoa. All right, so the answer is what is 3? I don't remember this thing. The answer is 1 is 3, guys. Let's go into it. All right. Ashley, you were the first person to come back with it. I got you, boo. So, all right. My apologies to TikTok. My phone died, but we're back up. First person to say what is 3 over here on Insta. Y'all can be mad at Momo again because Momo said what is 3 again. Momo got it. All right, Momo on Instagram. You got another 300 points, boo. So you now have 1,600 points. All right. Remember, guys, the point thing is just to make it fun. As long as you're correctly answering these questions, you're really winning, okay? First person on TikTok, even though my thing died, is Ashley Maney. Ashley, you already had 1,000 points, so you just got another 300, so you now have 1,300 points. All right, all right. Now let's go ahead and look into this rationale. So it says in the forming or initial stage, the members are identifying tasks and boundaries, aka setting rules. Storming involves responding emotionally to tasks. In the norming stage, members express intimate personal opinions and feelings concerning personal tasks, which is options 1 and 2. And in the performing stage, members direct group energy towards the completion of tasks, which is option 4. So option 3 is the correct answer. All right. Y'all got that? Almost I need that bundle. Girl, you already won. Girl, you won it pretty much. All right, guys. Y'all got that? What are your thoughts on ADN? Can anyone tell me your thoughts? It's honestly, it's what your thoughts are. Everyone here is either in nursing school, about to, either getting their licensed practical nurse or registered nursing license. So nursing is definitely the thing for them. Now, which one they're going for, it depends on your finances. It depends on what you want to do with your life, with your nursing degree. It depends on you. But nursing, period, everyone here is interested in nursing and actively moving towards completing that goal. So everyone here is on hey, nursing is where it's at. Okay. What do we just do, y'all? Mental health for 300? Y'all want to do, which one y'all want to do next? Momo, you tell me. Tell me, Momo. And then Momo tell me on Instagram. And then Ashley Maney tell me on TikTok. Because y'all have just been, killing it. Tell me which one y'all want to go for. Kick Rocks, if you're still here, which one do you need help in first? All right, let's go back to fundies. Momo said fundies. Let's go back to fundies. We just did mental health, Sugar Lips, so we can probably go back to that. So let's do fundies, and then after fundies, we'll do peds for 400 that Ashley wanted. All right, so fundies for 400. Which outcome should the nurse expect to observe in the client who's recovering from viral hepatitis without complications? 1, presence of asterixis. 2, increasing prothrombin time values. 3, decrease in aspartate aminotransferase, aka AST. And then 4, decreased absorption of vitamin K in the intestine. Which outcome should the nurse expect to observe in the client who is recovering from viral hepatitis without complications? All right. So y'all need to I'm seeing y'all say 3, but you need to tell me why. Why did you choose 3? If you chose 3, you need to tell me why. All right. Now, this is example. This is a good example. If you didn't know this, just plain off rip, this is how that critical thinking comes into play. Okay. All right. So I'm looking at what you guys are saying, and I'm going to read out what y'all are saying. And this is why I want y'all to pat yourselves on the back, because this is the thinking and the critical thinking and that clinical judgment that they're looking for. All right. So great job. So what do we know about this client that's recovering from viral hepatitis? All right. Hepatitis has to do with what? It's inflammation of the what? Hepatitis is inflammation of the what? The liver. Absolutely. So if we're recovering from inflammation of the liver, what can we expect to observe? And the answer is what is 3? A decrease in AST, because AST is, what do we know? That's a liver enzyme. Okay, so if we're observing or taking care of a client that has inflammation to their liver, we can definitely expect for those liver function tests to be a little bit abnormal. You feel me? That's an example of clinical judgment. All right, now it says complications from viral hepatitis include bleeding tendencies with increasing prothrombin values, and abnormalities of liver function. All right, liver function tests or liver function enzymes are a good indicator of the liver function, and those liver function tests include AST and what else? Give me another enzyme that indicates liver function. We already said AST. Somebody already said it. But let me ask it again. Let me scroll up and see who, though. What's another liver enzyme besides AST that we can expect to monitor for those liver enzymes? Give me another one. ALT. Right. ALT. Exactly. And I don't mean like control, alt, delete. I don't mean ALT as in alt. Okay. I don't got alt over here. But ALT as in the liver enzyme. Great job. So it says clients also can develop encephalopathy. All right. A characteristic sign of encephalopathy is asterixis. Serum transaminase levels such as AST decrease, and vitamin K become absorbed as liver cells heal and regenerate. All right. You guys got that? Oh yeah, alkaline phosphatase as well, as far as the liver enzymes. Great job. Okay. Another thing, what do we know about the liver and clotting factors? What do we know about the liver and clotting factors? Seriously? I'm mad if it died. Hold on. What do we know about liver and clotting factors? What do we know about the liver and clotting factors? What the hell? Wait, I'm gonna. Hi, y'all. Just because I don't know what that is, and I'm not trying to be embarrassed. The computer's doing something weird. What is happening? What is that? Okay, it's off. Hold on 1 second. Wait for it. Yo, that really freaked me out. 1 second. I was like, did I break my computer again? Again? All right, so sorry, my bad about that. The liver produces vitamin K and those clotting factors. So that's why with liver damage, you'll have less clotting, which means you'll have bleeding tendencies. Great job, Hannah. Great job. Great job. All right, guys, y'all ready? Did I say who got those points? I don't think so. Let me go to the next one while I get who got those points. 1 second. And then let's do peds for 400 while I'm getting those points. Boop. All right, guys, peds for 400, and this is our last question. Read that, read that. Ashley Maney got that as well. So Ashley, I'm going to get those points to you. All right, Ashley Maney. And then on Instagram, let's look and see who got this one. All right, guys, this is pediatrics for 400. It says a primary healthcare provider prescribes an IV solution of 5% dextrose and a half normal saline, or 0.45%, with 40 milliequivalents of potassium chloride for a child with hypotonic dehydration. Hypotonic dehydration. The nurse performs which priority assessment before administering this IV prescription? 1, obtains a weight. 2, takes the temp. 3, takes the blood pressure. Or 4, checks the amount of urine output. Remember to say your answer and then tell me why you got what you got. What's your rationale? What is the reasoning behind why you chose the answer you chose? All right, and y'all are saying like, what is 3? I'm getting what is 4. I'm really getting 3s and 4s, honestly. So tell me why you chose the specific one you chose. All right, so some of you guys are saying 3 because they could have hyperkalemia. I'm saying if you're giving fluids, you need to check BP before. Somebody said, I really don't know. So let's look and see what that answer is. Y'all ready? Momo said you need to know the ins and outs because potassium is excreted by the kidneys, so you need to make sure your kidneys are working. So let's see. What is 4? What is 4? What is 4? All right, so great job, guys. Momo, you got that one on Instagram. And then there was someone that was screaming what is 4. And then Susie Carmichael got what is 4 on TikTok. All right. All right, now let's go ahead and read it. It says, in hypotonic dehydration, electrolyte loss exceeds water loss. The priority assessment before administering potassium chloride intravenously would be to assess the status of the urine output. Potassium chloride should never be administered in the presence of oliguria or anuria. And anuria, what does that mean? What does oliguria mean? And then what does anuria mean? Let's do this one first. Oliguria. What does that mean? What does that mean? Come on, prefixes, suffixes, and all that good stuff. Oliguria, it means like scant. That urea means urine, and then that that prefix means scant. It means a little bit. So you're not supposed to give potassium chloride whenever you have a decreased amount of urine output or absence of urine output. All right, urea means urine, and means absence of. Olig, that means decreased or scant or a little bit. If the urine output is less than 1 to 2 milliliters per kilograms per hour, potassium chloride should not be administered. All right. Now, although options 1, 2, and 3, weight, temp, BP, although those are appropriate assessments for a child with dehydration, these assessments are not related specifically to the IV administration of potassium chloride. All right, so that's why number 4 was correct. All right, I think Momo said the rationale. So great job.